And when I saw this poster, it really sang to me. I wanted knees that don't tremble and ache, a good night's sleep that fixes my fatigue, medication that helps me and doesn't make me crazy, joints that move freely without pain or stiffness, headaches that disappear with a dose of Tylenol, muscles that relax and don't remain hard or twitching, tolerance to temperature change, and the ability to overdo it and not suffer for days or weeks. So today, my main objectives are to become aware of presenting challenges mostly common found in individuals with EDS, become aware of how food and nutrition can play a significant role when coping and living with EDS, and develop critical thinking and therapeutic strategies when living with EDS. So during my work in my profession, I met lovely patients who I worked with who had chronic pain and who was diagnosed with EDS. And when they came and spoke to me, I really understood what they were saying. I comprehended what they were saying because I too was feeling the same thing. Some of the challenges when people came to me and said, my body is so unpredictable, my legs hurt, my arms, my fingers, my stomach, my head. One day I feel fine and the next day I feel so terrible. People look at me and think, I have nothing wrong with me, but in the inside I feel so much pain. I'm going to walk from point A to point B as they look at me and say, wish me luck. I always said I should wear a t-shirt like this, especially when I'm brought to the ER, which says, this content may shift in transit. Do handle with care. Other challenges is, how can I find that comfortable position so I can get a good night's rest? I'm worried if I sleep, I will wake up with something dislocated. Yet again, another medication, a sleeping aid. I'm so tired in the day. How am I going to function? Well, definitely this is how I feel throughout the day. If that was sleep, I would like a refund. Other challenges, I feel like no one will understand my chronic illness. I don't even know who can help me or how to cope. I want to pursue my dreams, but now that I'm diagnosed with EDS, they feel shattered. I feel so anxious and worried, and when I am too tired of worrying, my family takes over and worries about me. A lot of my patients come up to me and said, I don't want this. I don't want this diagnosis. And I thought this was a good poster again that says, I'm so happy I got this debilitating illness so I can stay in bed for the rest of my life instead of participating in society and making a difference to no sick person ever. So what can we do? What can we do from here? I have the privilege of working with dietitians at Sick Kids Hospital. And I always ask them, nutritionally, what can we do? Not only am I diagnosed with EDS, I'm diagnosed with ulcerative colitis and IBS. And it has been such a struggle for me to, function in society. I want to go to those fancy restaurants, I want to eat in public, but I also want to know where the closest bathroom is at the same time. I see a lot of heads nodding because I too understand that. So I do want to talk about nutrition. Although I'm not a dietitian, as I said, I do work alongside two fabulous dietitian and nutritionists at the hospital who I go and seek help and who is giving me some feedback about nutrition. So we have to ask ourselves is, why does nutrition matter? Well, balancing our meals and snacks with a variety of food groups will help supply our daily vitamins and minerals. We got to make sure that we're eating regular meals and snacks to increase our energy level because, as you know right now, we are so tired and fatigued. And I know we're near the end of the day and I'm still moving around and stretching and trying to keep my eyes open as we go. It's incorporating healthy food types and cooking methods can lower your risk of some chronic diseases. Following a healthy eating pattern has linked to improved moods of depression, anxiety, stress. And adopting a healthy living approach can support a positive aging experience and help us cope with aches and pains and other problems within our gut area that I've expressed of IBS, Crohn's, and colitis. So it's never too late to start. So hopefully today we're going to learn how to do that together, how we can look at nutrition. So there's 6 causes of inflammation that I've read and I'm aware of. And inflammation is an immune response to injury, toxins, allergy, or infections that causes pain, redness, and heat, swelling in the affected areas. Notably, there's 70% of our immune system cells are found along the line of our digestive system. And therefore, our immune system is hugely affected by the foods that interact with our gut. Personally, I don't believe that one diet or one way of eating works for everyone. One person's food may be another person's poison. So bear with me as I go through this. It's all about trial and error. It's about elimination diet. Maybe the first start to evaluate what works best. But for the purpose of today's talk and because of time, I thought that I would definitely talk about nutritional deficiencies and excess, as well as emotional trauma. So the first thing to do is to ask yourself this question. How does your body react when you eat a large amount of refined carbs? That's like sugars, grain food, or processed food. Then ask yourself, how does my body feel when I eat whole foods that are loaded with nutrients and are balanced? The first thing when I see a patient come to me, and what I have tried to practice it on, is what I call body scanning. Body scanning is to know your body, to see how different foods react to you, such as, for example, roughage. Can you believe that I'm one of those doctors that say to my patients that have problems with their stomach, don't eat too much roughage, don't have too much salad, and the parents are just looking at me like, what are you telling them, right? Raw foods, vegetables could be really hard on the gut. Fruits, things that are not cooked could be too much of excess, could be really hard. Seeds could be very hard. Different proteins, steak, beef could be very hard. So these are all things that we need to look at. Another thing that I do recommend is keep a food journal. Very important, because I don't know about you guys, but my memory is not so good. I don't even know what we ate this morning. So keeping a food journal, recording what you're eating really helps, especially when you're doing the elimination process. So as you age, your energy calorie decreases. But however, the requirements for nutrition, nutrients increases, like calcium. Calcium is very important. And I just listed here a chart that I made reference from the Canada's Food Guide, because that's what we have to offer in Canada to look at. So if you look at the servings of vegetables and fruits and grains, you can see that from the females, it's about the same here, males to fruits and vegetables. Meat alternatives are about the same, but as you get older, you can see that we need a little bit more vegetables and fruits for females and males. These are all the vitamins and minerals that just reading about, learning about EDS is very important. I actually went to go to get tested, and I found out that I was very low in vitamin D, as we learned this morning, very, very low. And that really interacts with how we absorb food and how we take in food and our energy level. So for vitamin B12, I also want to highlight these are some of the food sources that includes, as an example, vitamin B6, again, some examples, and food sources of iron. These are all things that you could go and get your blood test done if you haven't. I'm sure a lot of you have. But the two that I want to highlight today is calcium and vitamin D. As I get, calcium helps to maintain strong bones, and vitamin D helps to absorb and use calcium. Research has shown that the calcium and vitamin D can slow or stop bone loss. Again, it's not a cure for EDS, but it's about controlling and maintaining, as we all know. So, half of teens and adults consume less than the recommended calcium and vitamin D requirements, increasing their risk for bone loss and osteoporosis. So again, I think in the system now to get to see if you have low vitamin D, now we have to pay in Canada to get that. Pardon? Not if it's below a certain level. Yeah, but generally I know a lot of people that had to, a lot of my patients had to, but I recommended it.
They have to write on the position that it's a therapy.
Yes.
The initial testing.
That's right, yeah. So this is the required I use. I also work with children with, I work in the hematology oncology, children with cancer, and they also have low in vitamin D, so we did some research as well. And once I take my vitamin D supplements, I noticed that there was an increase in my energy level, so it does make a difference. I'm always asked, like, how can I get calcium, right? Especially if you have very low tolerances to, certain things. There's milk, there's soy milk, there's salmon, tofu, beans, spinach, all cooked. There's different things that you could definitely look at, but that's just a guide for a different menu food choice. And here's a sample menu. A cup of soy milk, 3/4 cup of plain yogurt, goat cheese, almonds, and cooked spinach. Again, as you know, a lot of people with EDS has tolerances for different allergies. So you gotta ensure that this is something that your body can take after you do the process elimination, food elimination. So here's the scoop on vitamin D. As we know, we live in Canada, we don't get enough sun. I don't know about you guys, but when it is cold, when it is raining, my body is affected. I have a hard time getting up. My bones feel very stiff. And it's just hard to move and walk around. But when I'm in the sun, I feel really good. I'm sure it's not a cure. Part of it is psychosocial, I'm sure. But we gotta ensure that we have a lot of vitamin D. It helps with our bone health, muscle strength. It actually reduces our fracture rates and reduces the rates of falling. It also helps to play a role in prevention of some cancers and autoimmune diseases. So vitamin D, I'm really pushing that for today. And here are some vitamin D sources of common foods. Salmon, cod liver oil, milk. A lot of my patients who are young just especially don't like salmon, cod liver oil. But once they see the benefits, it comes in different pills. I do recommend this. Vitamin D also helps for optimal absorption, combined with calcium and vitamin D in food and other supplements. The second thing that I really want to stress here as a mental health practitioner is looking how EDS affects us mentally. A lot of people are wondering, did my depression come after diagnosis or did it come before diagnosis? It could be both. But stress and depression, anxiety, that is, to hear about, and this is how it was told to me, well, you have EDS, you're deteriorating, have a good quality of life, and see where you could go from there. Well, not knowing what life brings, not knowing what tomorrow brings or how I'm gonna feel, this causes a lot of stress, a lot of depression, a lot of anxiety. And I know that stress, depression, and anxiety enhances our pro-inflammatory substances called cytokines in our body. So when I meet with patients, we do a variety of things and strategies and methods for healing emotional health. One thing that I always recommend is maintain a sense of normalcy. Know what you could do. Know your strengths and know your challenges. Promote activity. So even if that's a little bit of walking from point A to point B and you take that minute, do so. Swimming, I would love to, but I don't know how to swim, so that's one thing that's always recommended, but I don't know how to swim. Stretching, meditation and visualization like we did today, I do practice that with my patients as well. Write a journal, draw something to take away that feeling, a feeling like, why me? A lot of patients come up to me and say, why me? Why do I have EDS? Why doesn't anybody understand? And it's hard because we were trained as doctors to always have the answer. Until when I was put in this position and I'm a patient and I asked my doctor, why me? And she just looked at me and I said, you know what? That's the best answer you could give me because there's no reason why. So doing these things through writing a journal, talk therapy, I invite people to come talk to me, share their stories. Don't compare your life to others, and try not to compare your life to where you were. It's really hard. It's hard to let go, but don't give up. Build your relationships. Today I have my whole family actually over there, my brother, my dad, my mom, my sister, and it means so much for family to be here, and as this is my disease, my syndrome, it's also your family syndrome. So all young girls and guys out there, just know that, EDS affects not just you, it affects the whole family, community, your school, your friends. Educate yourself and others that want to listen. Some people don't want to listen. Sometimes I work with my patients in saying, how do I reveal that I have EDS to others? How do I tell my significant someone that I have EDS? And I've seen where some friends just left them because they couldn't function every single day. I had adults that came to me and wondering, how do I disclose to EDS when at my work and in employment? It's been a challenge. I'm still working, but knowing that there may be a time that I have to stop. Get your rest because you deserve it. I used to wonder why I'm so tired, and I linked that to laziness, where now I link it to I'm deserving of. And find your own spirituality, whatever that is, your centerpiece inside, and be grounded. Most of all, find a routine that fits you, not just psychologically, but also with diet and nutrition. Lastly, one thing I could say is to stay positive, stay strong, focus on what you can do and not what you can't do to help you glide through, each minute and every day. These are the nutritional resources. Again, I'm not a dietitian, but these are some really good nutritional resources that you could find a balanced diet. If you want to talk to me further about it, we can. I think finding a guide of IBS and colitis, ulcerative colitis and Crohn's is the way to go. And doing the elimination process diet is the first start to see what your body can absorb. And that's it. Thank you so much.
I was just wondering, recently in media I've seen information about FODMAPs. I don't know what the acronym stands for, it's pretty long. But they have an elimination of the diet there and the nutritious foods. Do you have any thoughts on that in relation to EDS? FODMAPs in particular?
Again, I could ask my dietitian regarding that. I'm very cautious about elimination diets and what that looks like. To some people, it's eliminating everything and then starting from afresh. I could look about that. I'm not 100% sure. It's really, that's why I didn't want to give a menu for everybody of what to eliminate and what not to, because everyone is unique in their own way. But that's something.
how do you go about then trying to just eliminate one food at a time?
Right, so I started off with having really severe allergies. I have it to fruit, vegetables, nuts, so it's really hard. I knew that if I was going to eat beef or some dairy, I'm going to have flares. So I knew what not to do. And then elimination diet means gradually incorporating the food after. So I start there. I start with what I can eat, which is fish, chicken. I need carbs, but there's whole grains that I could eat, specific diet. And then after I introduce, I'll see how my body feels. I do keep a journal. And then I'll try to add, let's say, a little piece of cheese. What I'm doing during the elimination diet, what you're doing is that you're cleansing your body. We have, in our gut, as I said, the inflammation, we have a lot of waste. And that waste is shown when our body can't absorb, it shows in flares. And everybody is nodding that they know what flares mean here, but it's continuous running to the bathroom back and forth. So elimination means starting eating clean. Not a lot of salt, not a lot of refined foods, not a lot of sugars. And eventually, like, you start incorporating that. And sugars are coming from natural food sources like fruits and some vegetables. But because of my allergies, I couldn't do that, unfortunately. I have to take supplements.
And how did you find out about your allergies?
I had allergies when I was really young, and then I went to go and I got an allergy testing, and I was told that I was allergic to a whole lot more of other things. And I'm anaphylactic for certain fruits and nuts, but other things were happening. So when my stomach was in pain, I thought, oh, I just ate too much, and then I got the full belly and stretch, and that's actually a result of that I'm allergic to these foods. Yeah. Yes.
What was the trigger that sent you to check this diet, to find out the diagnosis of EDS?
So my knees dislocate and my shoulder dislocated. And when I was younger, I used to be so competitive in gymnastics that, you know, it was like, wow, you're great, you could do this. But as you got older and you're in past your 30s, and then you keep on moving and you're still feeling chronic pain. It was something that they knew that it wasn't right. There was something wrong. I was also experiencing a lot of headaches, and just even when I'm walking, I would move and shift and fall down. And I, give or take, I was a clumsy girl, but it was more so, it was hard getting upstairs. Now I have a hard time sitting, and yeah. It was hard, actually. I've worked in a team with doctors, and sometimes people think it's psychosomatic. This has really helped me to refine the way that I do therapy. So, and how I look at the world. And I think, you know, yeah.
It's just a comment because you're referring to how, because it's a hidden disability a lot of the time, you try to explain it to people and they look, you know, they still want to put it in the psychosomatic, you know, catch-all.
Mm-hmm.
And I remember having to explain something to my dental assistant.
Yes.
That I had just received a certain diagnosis. And after I went through the cleaning and everything, she kind of put her hand on her shoulder and she says, well, you know, you have to learn to just breathe and relax. And like, so I knew in what direction she was going.
Yes.
And I kind of said to her, let me just explain it to you. This is a hidden disability. So if you had someone here who had no legs and didn't have any prostheses, would you expect them to run a marathon? She said, no. I said, look at me as someone who has no legs right now, so I can't run that marathon. You know, it's the same thing, only mine is hidden and others are not.
That's right.
And she went, oh, so it's really physical. And I said, yes, it is.
Mm-hmm.
So it's, you know, sometimes when you have the hidden disability, it makes it twice as hard to get the support you need.
That's right.
Because people look at you and, you know, is it laziness? Is it emotional? Is it just a lack of willingness to do things?
Mm-hmm.
And
It's
so,
also, unless you have the disease and have it at the end,
That's right.
there's a big problem. I mean, I'm every day getting into endometriosis. So I let pursue, and, go for it. Right? Any of these.
Mm-hmm.
It all correlate and go hand in hand with everything.
Mm-hmm.
But because they don't say disease,
That's right.
nobody takes you seriously. That's what the majority, highest percentage of these syndromes
Mm-hmm.
are women.
Mm-hmm.
Even though they have, like, I don't know here, but they do know children. 10 million in America for
Mm-hmm. That's right.
And it's similar, we do elimination study as well.
That's right.
We do go radical.
Right.
We do raw, or I do raw plus vegan.
Mm-hmm. It's definitely a process, definitely a journey, but it's one that I'm going to be on this route and this road for a very long time. Yeah, in support of. Thank you.
thank you.